Here's an idea to lower healthcare costs. What do you think about exempting healthcare spending, consumer spending, from taxes? What if we just said no taxes on healthcare spending? Your premiums, tax-free. Your deductible, tax-free. Your out-of-pocket expenses, tax-free. We already have, as I think Mr. White pointed out in a hearing recently, we have in place an approximation of this. If you itemize as an individual, if you itemize your taxes and you spend more than 7.5% of your adjusted gross income on out-of-pocket expenses, you can deduct everything above 7.5% if you itemize. So why not allow individuals to deduct everything? First dollar, make it tax-free.
Senator Hawley, thanks for coming.
Yeah, absolutely.
Floor is yours.
Thank you. Oh, dangerous thing to say. Thank you, Mr. Chairman. And thanks for waiting for me. I'm just coming from another briefing.
I didn't. I just kept droning on.
Well, it worked to my advantage. I'll be brief. I know the panel's been here for a long time, and I'll give each of you some questions for the record. But I just want to ask you, Mr. White, nice to see you again. I think I saw you recently in another hearing, and you've gotten the question I'm about to give to the panel. But let me just ask you this. Here's an idea to lower healthcare costs. What do you think about exempting healthcare spending, consumer spending, from taxes? What if we just said no taxes on healthcare spending? Your premiums, tax-free. Your deductible, tax-free. Your out-of-pocket expenses, tax-free. We already have, as I think Mr. White pointed out in a hearing recently, we have in place an approximation of this. If you itemize as an individual, if you itemize your taxes and you spend more than 7.5% of your adjusted gross income on out-of-pocket expenses, you can deduct everything above 7.5% if you itemize. Of course, businesses, big corporations get to deduct all of their spending. So why not allow individuals to deduct everything? First dollar, make it tax-free. What do you think? Let's just go down the panel, and then I'll give you questions for the record. Go ahead, Mr. Lehman. Do you want to pay less? Do you want to pay less taxes on your health care? That's the question. Who's going to say yes to that? But maybe somebody will. Go ahead.
I'm afraid I do not have the expertise of the tax code in front of me to give you a really good answer on that. Thank you.
Okay, Mr. Jacobs.
I'm going to follow this gentleman right here. I mean, I'm not that guy. I'm not the guy to ask this question to.
Mr. Reagan.
Senator Hawley, I think it's a great idea because then you're providing fairness to everyone. Whether I pay out of pocket or a premium or have some alternative, you're treating it the same. And government should be fair. It shouldn't pick winners and losers. Great idea.
Now, Mr. White, you said actually the other day, and I thought this was a great point, taxes make everything more expensive. So if you want to reduce costs, why not lower taxes, in this case on health care, which are exorbitant. But go ahead. I'll let you fill in or not.
My answer hasn't changed. Great idea. We should do it.
Great. Mr. Steele.
Senator, I have 4 kids, so I'm in favor of lower taxes.
Yeah, very good. Mr. Briggs.
Would have made a big difference in my life if that had happened.
Yeah. All right. Well, thank you all for being here. Thank you for your testimony and your expertise. Like I said, I'll have some questions for the record, but I'm sure you're eager to catch your breath. Thank you for waiting for me.
Senator Hawley's going to give those 4 $20. You want to take a shot at getting $20 from Senator Hawley for just by saying yes, it's a great idea? Apparently not. Yeah, I think with that, there's more ways to skin a cat here, right? I do think Republicans have a lot of good ideas on how to do this. The question is, how do you implement it? How do you implement it where you have Obamacare structure still there? When you start bleeding people off of Obamacare, that's going to make it even worse for those exchanges. You kind of got to start from the ground up, truthfully. But also understand we're really talking about a pretty narrow percentage of the American public on the exchanges, which has kind of screwed so many things up. It's, how do you bust up some of these oligopolies, truthfully? I mean, we got to figure out antitrust. They've consolidated. We need to restore competition. Again, that's my main point. The main principle, you need competitive markets. You need consumers worried about how much they're paying for things. And I think Senator Scott mentioned that surgeon in Oklahoma. Cash on the Barrel had his rates for surgery were 10% of what hospitals are charging. I mean, that's remarkable. But that's what's possible out there if we can bring consumers back into this. So again, I appreciate the fact Senator Slotkin wants to work with us. If that's true, happy to do it. But we really do need the other side to admit they have a problem, not say this is the greatest thing since sliced bread. There's no problem here. Just throw hundreds of billions of dollars at it. That's not a solution. It's not certainly something that I can support. But I truly do appreciate all your witnesses. I will give you, if you do it briefly, we'll start with Mr. Briggs. Do you have a final comment that's just burning that you got to get out there?
Yeah, I do actually, and it comes down to this question of fairness. So I was trying to explain to my family a few years ago, like, why is Dad so exercised about our problem, right? And I said, well, imagine, you go to the grocery store last week and you went and bought your favorite candy bar. Say it's a Snickers bar. And you've been doing this for a while, and last week, like every other time you went there, and it would cost $1.50. Price is right on that thing. You go to the cash register, and you pay for it. It's $1.50. Elon Musk is behind you. He buys a candy bar. It's $1.50. Someone from the lower middle class is $1.50. So the way we sell healthcare in this country, at least under Obamacare, is as follows. You go into the grocery store. There are no prices on anything. You take that candy bar to the cash register, and you say, look, there's no prices. What happened? What are you going to charge me for this? And the register, the cash register, the cashier says, show me your taxable income, and then I'll tell you how much I'm going to charge you for it. So for me, it's $5. For the guy behind me, it's $1,000. For someone behind me, it's $2. So what we no longer can suffer under anymore is the equity of fair cost. This is what we really need is the equality of real prices, and that's the huge difference. I have no idea how much I'm going to be charged when I bring my cancer-ridden daughter in for any of her treatments, big or small. Right. And this is the problem. Equity of fair cost will destroy us. Equality of pricing is the answer.
And having consumers do this, that literally solves the problems. Mr. Hawley.
Thank you, Senator. I would just say that every dollar that is spent on an able-bodied adult is a dollar that can't be spent on the truly needy. And so as Congress looks to address this, one of the most important things that has to be looked at is the fact that we have these perverse incentives that were created by Obamacare. And unless that's taken care of, the truly needy will continue to be at the back of the line.
By the way, Senator Scott had a really good proposal. He just caps off enrollment for that 9-to-1 match. States wanted to, bring in able-bodied adults, fine, but you're going to get paid the same amount as you get for a disabled child. Unfortunately, because hospitals and states have based their budget around that, the scams created by 9-to-1 match, we couldn't get that done. And so we still have that inequity and that perverse incentive where able-bodied adults are at the front of the line rather than the back of the line. Mr. Roy.
This bill that you will vote on tomorrow, the Crapo-Cassidy legislation, is a step in the right direction, and I would blow it out. I would make it massive. It would change significantly the dynamic in play right now where we are empowering insurers over consumers. If you give the money to consumers, you change the dynamic in the market, and you force insurers, doctors, hospitals, everyone else to compete for the money that the consumer controls. If you do that, prices come down, access opens up, people start getting better care. So that would be the biggest change you could make that changes this dynamic, the unsustainable trajectory we're on, where costs are ever increasing, subsidies are just going through the roof, insurers are empowered, and consumers are at the back of the line.
And because that is a solution, the medical establishment cartel, they would hate that. So they're going to do everything they can to lobby against it because the system that we have right now is working beautifully for them. It's just not working so good for the American people. Mr. Bragdon.
I think it's really important to look at what are solutions that help everyone. Right now we're talking about a vote on these COVID credits that really empowers insurers to improve their stock price and to put a bunch of money in the bank, but leaves folks with pre-existing conditions with massive deductibles, massive out-of-pocket limits, and no access to providers who can actually help them. And what we need to focus on is how do we help the truly needy, but how do we have more choice and empowerment of patients so they can get the care they want and need to get healthy?
Mr. Jacobs.
First off, I want to say thank you for having us here. I think this is incredibly important, and I think you're right. I think it is broken. But while you're trying to fix it, don't take away the things that are helping Americans. Don't take away the subsidies. But again, I know that you think.
Let me just quickly.
Well, can I?
No, I'll let you.
I thought this was my final.
We're not taking away the subsidies. They're going for the vast majority. For the vast majority of people. those subsidies remain in place from original Obamacare. Now, the enhanced subsidies would go away, you're right, but I mean, don't mislead people.
Right.
All the subsidies are going away.
No.
The vast majority are staying in place. But go
Right,
ahead.
and I know
and
it's
I
a-
apologize for interrupting, but I think it's important.
Okay, I know that you're talking about a narrow population, but that's still 24 million people. That's a lot of people. And I think those people truly need the help. Thank you.
Well, a huge thank you to the chairperson, the ranking member, and the entire committee for letting us share about our farm and about our communities. And we do want to work together to address concentration and consolidation that really impacts our rural areas. That's an important area for us to continue to work together on. I just want to emphasize that the Affordable Care Act works when I can invest more and my neighbors can invest more of their time and resources on the farm. It works when we can bring the next generation onto the farm. And it works when we can improve and change jobs in rural America freely. So again, that doesn't happen when healthcare is not affordable. So making affordable options for folks is extremely important. A huge thank you to the committee. Thank you, Senator Johnson.
Really appreciate all of you coming here and enjoying the exchange. I mean, this is kind of like not a normal Senate hearing, so appreciate that. I agree with you. We have to make health care more affordable. Obamacare didn't do that. It just didn't do that. Again, 24 million people, 6 of them are probably phantoms. So that's costing us, according to Paragon, about $27 billion per year of fraudulent payments into the insurance companies. That's one of the reasons their stock price is so high. $27 billion. I mean, that's, the people are being prosecuted. This isn't make-believe. So about 4 million, take it away 6, or probably about 18 million on the exchange. 16 million plus will go into the old Obamacare subsidies. You don't like that, complain to Obama. We're talking about 1.6 million people, and I would like to help those people. I wish we could have got that into the Republican alternative here, but I will be working in good faith, already talking to some Democrat senators about working on that. When it's going to fail tomorrow, unfortunately, we know the result. I don't like this place either.